Hello, everyone. Welcome to a discussion today on stroke. Um, Tomorrow is World Stroke Day, and Patients Engage and Boehringer Ingelheim are kicking off a series of webinars over the next few weeks to spread awareness on different aspects related to stroke. Today, we are very privileged to have with us Dr. Bhushan Joshi, neurologist at Manipal Hospital in Pune. And we will be talking of whether gender makes a difference in how stroke presents itself and how it needs to be managed and risk factors associated with stroke. As I said, this is part of a series called No Stroke for No Stroke. A quick word about Patients Engage. We are an online platform where we seek to make sure that people are better informed to manage chronic conditions, and the better informed they are, the more empowered they feel and make better choices. And we also strongly believe that it's important to share experiences so that no one feels that they are dealing with this alone. As I said, we have Dr. Bhushan Joshi to talk to us about how gender affects presentation of stroke as well as management of stroke. Quick reminder to our audience that the views expressed in this video are of the physician and only intended for spreading general awareness. They do not replace a medical consultation, so please do consult your doctor or Dr. Bhushan for specific medical issues separately. And the views may not always reflect those of the publisher and or the sponsor. As always, you can contact us through our website, www.patientsengage.com, or on our social media pages on Facebook, Twitter, Instagram, YouTube, and LinkedIn. And we are currently live on the Facebook pages of Boehringer Ingelheim and Patients Engage, as well as the YouTube channel of Patients Engage. So you can post your questions and we shall try and pick them up. So welcome, Dr. Bhushan. Thank you for joining today and taking time from your busy schedule to do this.
Thank you. Thank you for kind introduction. Yeah.
Thank you. Let's start with the basics of what is stroke and, what people should be aware of in terms of signs and symptoms.
Yeah, first of all, I like to appreciate both Patient Engage and Boehringer for creating and this series No Stroke for No Stroke. Stroke needs awareness, and this is good initiative, and I'm happy to be a participant of this event. So what is stroke? Stroke, in simple words, we can say stroke is a brain attack, which happens because of disruption of blood flow to brain. When this can happen either because of two mechanisms. First is blood flow gets blocked because of clot of the blood in blood vessel, or rupture of the blood vessel leading to spillage of blood out of blood vessel. In both cases, brain is damaged, resulting into paralysis. So that is stroke.
Okay. And what are the typical signs and symptoms that people should be aware of?
Correct. So most of the time, people the body is stroke, but there are other typical symptoms also. World Stroke Organization has given us a simple mnemonic to remember that is BEFAST, BEFAST. B is right. Balance. So if a sudden appearance of imbalance or giddiness is B, then E is eye-related signs. If patient starts suddenly seeing double, or there is sudden loss of vision, then that can still be a stroke. Then next is F. F is face. So asymmetry of face, drooping of one side of mouth can be a sign of stroke. Then A is arm or leg. Any weakness of your one hand or one leg, inability to grip, or in some cases even inability to perceive sensation can be a stroke. Then speech, slurring of speech, sudden development of slurring of speech, or not able to pronounce proper words, loss of language function can be a stroke. And then last one is T. T is time. If any patient develops any of these above symptoms, or you're known is having those symptoms, and then you should recognize it as a stroke. And T is time. Time is brain. So within 4.5 hours from the onset of stroke, if patient can receive certain type of treatment, potentially stroke can be reversed, or at least the maximum possible damage can be prevented from actually getting established. So that is important.
Right. I think I would just like to highlight that while it's important to try and get, within 4.5 hours, but does not mean that if it's crossing 4.5 hours that you don't take action, right? So
Right.
you should still take action, even though it may
Mm.
be a little more than 4.5, but try and get to as soon as
Yes.
possible.
The simple bottom line should be time is brain. So as early as possible, stop
Right.
everything, go to a stroke ready hospital. Yeah.
Correct. Yeah, and I think I would want to highlight there as well that go straight to a hospital. Sometimes people, kind of say, okay, let me go back to my home and then
Mm.
go, or things like that. So as you
Yeah.
said, go to a stroke ready hospital.
Yes.
Um, what are the risk factors for stroke?
Yes. So stroke is now one of the leading cause of mortality, means death, and morbidity, means loss of quality of life in Indian population or across the world. So it is increasing, particularly in Indian population. So we divide these risk factors basically into two: conventional or modifiable risk factor and non-modifiable risk factor. So as we age, that is most common. As along with age, risk of stroke is increasing. So age is conventional risk factor. Our ethnicity, our race is a non-modifiable risk factor. But amongst modifiable risk factors, so hypertension is the commonest cause of stroke, blood pressure.
Mm, mm,
Second is diabetes, similarly. Uncontrolled blood sugar. If you're hypertensive, your blood pressure should be well controlled. Same is for diabetes. Then cholesterol levels, atherosclerosis. So high cholesterol levels are a risk factor for stroke. Simultaneously, cholesterol levels are more common in obese individual.
right.
Obesity is modifiable risk factor, and almost we are facing epidemic of obesity type of situation because of our lifestyles. Obesity, addiction is increasing, particularly tobacco in any form, chewing, smoking, or I mean in rural part they use it for brushing. So
Mm,
tobacco in any form is risk factor. I would like to mention along with tobacco is independent of its quantity as a risk factor. I mean, it doesn't matter if I'm say taking say 10 cigarettes in a day or one cigarette in 10 days, the risk is same for both. So it should be zero. Second is alcohol. Um, so WHO says like 60 milligram of red wine is for female and 90 milligram for male is okay, but and that is negligible. So I'll also suggest to stay away from alcohol as well. Apart from that, recreational drugs, cocaines and ganjas, and those are a risk factor for stroke. Two significant risk factor, particularly I'm experiencing in my practice, is sedentary lifestyle. Sitting
mm,
at single place for continuous more than 6 hours is an independent risk factor. You can compare it to 10 cigarette a day. And same is sleep. If you're not sleeping at least 7 hours or 6 hours at night, then it is an independent risk factor. No matter how much you are exercising and how much fit you are, but if you are not sleeping 6 hours, that increases overall risk of stroke. So these two points I would like to highlight in risk factor.
right. And, since our topic is on gender, are women at higher risk of stroke than men, or are men at higher risk of stroke?
Yeah, the uh, answer is simple but scary. Yeah, women are at more risk of stroke compared to men. The incidence, if you ask me, is like 180 individuals or men per 1 lakh population can get stroke in 1 year. And
Hmm,
for female, it is 180, 118 for men and 180 for female randomly. That
right.
is incidence, like how many new strokes can happen. So it's clear it is more common in female patients compared to male patients. If you look it like in concept of prevalence, like how many patients are having stroke or have suffered stroke in their lifestyle,
Hmm.
the numbers are more scary. If every one female out of five can get stroke throughout her lifespan. So women are definitely affected more compared to men.
And the risk factors are the same for both,
Yeah,
is it?
the risk factor, correct. So the most obvious reason they have found out during studies is longevity. Female have a longer lifespan as compared to male, so that exposes them for a longer risk of getting stroke. Hypertension is more common in female compared to male gender. Second, the factor is particularly very specific for female gender is pregnancy and
Hmm.
pregnancy related hormonal changes happening in the system. So pregnancy increases the risk of stroke compared to non-pregnant state. And use of contraceptive hormones, certain types of contraceptive hormones, particularly which are rich in estrogen, can increase the risk of stroke. The stress related events, depression is more common female gender, so that again increases the risk of stroke in female gender. These are some factors they have found out which makes that risk more common in female gender.
Right. So let's look at pregnancy, because obviously, most women do go through pregnancy. And you said pregnancy increases the stroke risk. So how does it affect the stroke risk? And is the risk the same for every pregnancy?
Yes, pregnancy. Correct. See, pregnancy is entirely different phenomena happening inside female body. There are a lot of changes happening. So those changes definitely contribute. First thing happens in during pregnancy is increase in blood volume. So heart has to pump 50% more blood compared to non-pregnant state. So that
Right.
if patient is having some background cardiac issue, increases the risk of stroke. Second, the pregnant during pregnancy, human body tries to make our blood thick in order to prevent naturally the blood losses happening during labor. But that thickness of blood increases the, of course, risk of clot formation elsewhere. If that female is particularly having some blood vessel diseases, and thick blood increases the risk of stroke. Age of pregnancy, particularly nowadays, because of career and modern lifestyle, most of the pregnancies are happening in if not early, at least late 30s. So late 30s, early 40s, and pregnancy increases the risk of stroke formation. So apart from this, there are delivery related complications. Some pregnancy induced hypertension, eclampsia. Eclampsia is hypertension plus certain hormonal changes happening. Increase the risk of stroke during peripartum period, we call it. So these are the some specific risk factors which are happening in pregnancy. The second part you mentioned about is the risk is same for all pregnancies. So I mean, that depends on the conventional risk factors. Already, if a female is suffering with hypertension, diabetes, and she is elderly, then the risk is higher during that. And compared to otherwise healthy younger female, the risk is low. If you have stroke during first pregnancy, the risk of getting it again in second pregnancy, is high, but not with significant factor. It is around 5 to 10% higher compared to other female without history of stroke in past.
Right. And so therefore, okay, are the signs and symptoms of stroke? So if you look at BFAST, is it the same for symptoms during pregnancy as well?
Yeah, see, BFAST will hold true during pregnancy, but apart from that, as I said, hypertension related complications are more in pregnancy. So most of these strokes are not of ischemic stroke or infarct, which are otherwise seen in 85% of strokes are infarct. But during pregnancy, almost 50% of strokes are because of bleeding. So rupture of the blood vessel. So sudden onset headache, thunderclap headache, we call it. And minute back patient was normal and worst headache of life within 10-15 minutes. That can be a
Correct.
typical sign which should warn the presence of stroke in that case. Then convulsions or fits. These are these can be atypical signs symptoms of stroke during pregnancy. So we
Right.
usually counsel our patient regarding these red flags, as we call. So certain bad headache, fits, loss of consciousness. This can be apart from the first sign symptoms of stroke.
So therefore, what is the screening that women who are pregnant should go through, or what is the monitoring that they should go through to ensure that they have a healthy pregnancy?
Correct. For overall pregnancy, there is no specific screening in isolation developed for stroke prevention during pregnancy. But
Right.
yes, overall cardiovascular risk factor assessment, particularly if you're planning pregnancy in your late 30s, early 40s, then you should, before getting pregnant or before planning pregnancy, screening for hypertension, screening for diabetes, getting your heart tested by doing 2D echo or treadmill test. So cardiac reserve factors are lipid profile. These are the conventional screening. But some female patient can be of particularly higher risk. Those who are getting conceived through um, um, IVF or supported pregnancy medications. So they are usually on higher dosage of hormonal pills before their pregnancy, but that increases risk of additional pregnancy induced stroke. Those female
Right.
patients needs to be screened for stroke related complications. So
Right.
apart from that, the general screening remains same.
Okay. Um, so in terms of other than kind of making sure that you regularly screen, what are the tips that they should follow, or what is the lifestyle changes that they should follow to ensure that they maintain a healthy pregnancy?
Maintain healthy pregnancy. Firstly, pregnancy in our society is like pregnant female should not exercise. She should be resting throughout pregnancy, and they are fed with like high energy, high calorie diet. So weight gain is in excess as compared to normal pregnancies. If you compare with other countries, Indian female, particularly in urban society, are tending to get more weight. So continuing exercises throughout the pregnancy is important. That is one factor, and there is no need of taking additional in excess of whatever is advised by your gynecologist. On top of that, no need to consume fatty food or ghee or something of that sort. That is going to add to your cardiovascular risk factor. So these two things I'll suggest: exercise and diet control, particularly in pretending to the prevention of stroke during pregnancy. And we
Right.
have seen like basic screening we have done already. So on top of that, if patient had history of certain medical conditions in past, or she had a history of stroke during previous pregnancy, then their gynecologist or neurologist will suggest them to be on certain medication, blood thinners. In some cases, those female getting pregnant have to use certain injections throughout their pregnancy.
Right. Right. Okay. So coming back to the overall risk, right? You talked of the overall risk. You also talked of different types of stroke. So maybe for the lay audience, again, you can explain the different types of stroke because I think people may not have kind of fully understood that.
So, stroke, as we discussed initially, is a brain attack. Brain attack is lack of blood, disruption of blood flow to normal brain tissue. Disruption. So disruption is in terms of like blockage of the pipeline, which is because of clot. If that happens, stroke resulting from a blood clot, that is called as infarct. And those are more common strokes. 85% of general stroke in general population are infarct. And If by any reason that blood vessel is ruptured and blood starts flowing out of the blood vessel into normal brain tissue, that blood once out of the blood vessel is toxic to body parts. So that causes damage to brain, leading to
Right.
again stroke. That is called as hemorrhagic stroke.
Hmm.
Apart from this, there are two other type of strokes. First of that is subarachnoid hemorrhage. Sometimes our blood vessels are not healthy. They develop outpouching called as aneurysm. It's like balloon-like
Hmm.
structure happening in the blood vessel. And because of any reason, if that aneurysm ruptures, then that leads to very devastating stroke called as subarachnoid hemorrhage. And apart from that, the other type of stroke is called as venous infarct. Most of the time, strokes happen because of arterial blockage. Arteries are blood vessels carrying pure blood to brain,
Right.
and if the oxygenated, deoxygenated blood or used blood, which is carried back to our heart, those blood vessels are called as veins. And if those
Right.
veins are blocked by any reason, then that leads to a venous infarct. So, in order of frequency, infarcts, that is clot related strokes, are more common, and then 15% are ICH, means intracranial hemorrhages, subarachnoid hemorrhages, and then venous infarcts. So these are the four major type of strokes.
Okay.
Overall,
Okay.
uh, time is
Yeah.
important in all these strokes. Sooner we
Right.
start treatment, we can reverse or stop this stroke treatment.
And
Stroke
which of these you said infarct is the most common?
infarct is most common, yes, during pregnancy, but because of the hemodynamic changes, this increasing blood volume of the body and increasing blood pressure tendencies, we
Right.
pregnant will tend to get more bleeds compared to infarct. So that ratio is almost 50% to 50% infarcts in
Okay.
pregnant.
But for the average, if we say what is the ratio of stroke across population, it is
It is
it
infarct. 85% of time it is infarct.
okay. And if you look at the effect of stroke, right, people have multiple effects of stroke. Your speech, I mean, long-term effects, especially if you look at this speech, vision, movement, etc., cognition. So, is the impact and severity of stroke different in both genders, or is that pretty much the same?
Correct. So when my patient is suffering with stroke, it, rehabilitation before that is a treatment of acute stroke. So when stroke is fresh within, like as we said, 4.5 hours, or even up to the discharge from hospital, first 7-8 days, that is acute treatment of stroke. That remains same for both. We have to treat them aggressively, and at this phase of treatment, we try and stop the brain damage which is actually happening.
Hmm.
Beyond that, at the end of that initial phase of treatment, now brain has suffered damage. So that part of function is already lost. Now patient has to recover. That is rehabilitation. So rehabilitation is a long and intense process. It
Hmm.
requires input from patient more than that input from family members. It requires cost as well. So
Right.
um, that is something which doctor usually don't see in hospital. That
Hmm.
happens at
At
home,
home. Hmm.
at the society level and
Hmm.
physiotherapy centers, that level. So what I have seen and is experience across, that inputs definitely change according to gender. Uh,
Hmm.
Somehow we consider male as a earning member, so we want him to be back and normal and fit. So uh, efforts are put more um, in male patient compared to female patient. Now if we delay that rehabilitation process, physiotherapy, beyond certain point, and then if patient is not receiving that particular dose of exercise physiotherapy, the end result differs. So end
Right.
of 6 month, 1 year, we measure stroke recovery in terms of certain scoring system, MRS scoring system we call it. So those
Hmm.
who have received good amount of consistent physiotherapy have a better uh, score on that scoring
Right.
system. So, in other words, they have better quality of life. So, here I can say, because of lack of inputs or negligence, or
The
inadequate
social
effort,
disparities. Yeah.
social disparities is kicking in, and uh, end results are different for men and female because of lack of probability. But biology doesn't differ. So if we treat them equally, the end result is equally equal in both the gender.
Right, right. And if you can just highlight the various aspects, because I think most people are aware of the physical movement issues of physiotherapy involved, but what we
Mm.
found is that there is a little bit less awareness on speech and vision and
Vision.
kind of the mental health
Oh,
issues as
yes, yes.
well.
Correct, correct. So, firstly, like even during physiotherapy, physical part of the rehabilitation, physiotherapy exercise, most of even in well-educated families, I've seen patient mixing it with massage. So
Mm,
instead of going to a physiotherapist, they hire some massage specialist or so-called physiotherapist who is not trained into that. So massage and physiotherapy exercises are altogether different. So
right,
when those particular exercises are done, we are actually trying to stimulate brain so that it can take over the functioning of the lost brain. So that
right,
is, yeah. But as it's apparently visible, so more efforts are put on that. Stroke significantly affects our language.
mm,
So particularly in uh, say IT industry or modern urban population. So most of the jobs are dependent on how you speak, fluency
correct.
of language, vocabulary. So that is also lost. Speech
Mm,
therapy helps in recovering from this type of language related stroke. Particularly left side of brain controls our language. So
right,
speech therapists use different techniques like asking patient to read, using sign language, using music as improvement of a language, then coding now using keyboards and mobile. So that is an altogether different language that requires rehabilitation. Our brain controls our emotions. Emotions are not separate somewhere, stored somewhere else. So
mm,
certain part of brain, if are affected, leads to cognitive decline, emotional increase irritability, increase anger. So those
right,
cognitive dysfunction also require cognitive training, and
right,
that actually affects quality of life significantly if you
correct.
attend on cognitive. Same way, vision is also lost in stroke. So visual training exercises apart from physiotherapy is definitely helpful in long-term rehabilitation. And then lastly, occupational rehab. When patient, if you measure function of say uh, his hand or finger, that is normal, however it's normal, but that coordination to type and create that speed of typing is difficult. That also patient has to relearn again. So
Right,
that occupational rehabilitation also is required after stroke. It's not
right.
just physiotherapy means physical exercise. That is a correct point you mentioned.
Correct, correct. Thank you so much, Dr. Bhushan. Uh, any final message or to our audience out there, or any other aspect that you think we've not covered and you would like to stress on?
Yeah, I mean, whenever I'm talking about stroke, I just like want to emphasize about timing after initial assessment, that you have recognized this is stroke, then you have to be very fast because each second count. We can reverse stroke if we reach a stroke ready hospital, receive particular treatment in that time span. Then we can reverse that stroke. That is the key message I want to convey through this discussion. Female gender increases the risk of stroke, but recovery actually is same for men and female if that social disparity we take into account, and uh, putting that effort into female patient also is important,
Right,
because recovery of a female in house, I mean, is equally important for overall social health of that family. So that is another thing I would like to mention. And a typical those risk factors, sitting, prolonged sitting despite of
mm,
exercise, is independent risk factor, and lack of sleep is independent risk factor for stroke.
Right.
So avoid sleep deprivation every 30-40 minutes, at least stand for 2 to 3 minutes, so that we can avoid that increased risk associated with these two not so commonly known risk factor for stroke.
Right. Right. Thank you so much, Dr. Bhushan. Just a quick update, as doctor said, that rehab and recovery takes time. We've seen through a lot of our patient stories that it can take sometimes a couple of years for them to get back to kind of reasonably functioning mode. But they are stories of hope, so you should persist. I think often people give up after the first 3 to 6 months. So it's important to keep persisting, and there are support groups you can join. There are narratives that you can, lived experiences of people that you can listen to and talk to. So because those really help to not just for the patient, but also for the family to understand what's happening and how to deal with it as well. And I think Dr. Bhushan's highlighted very clearly the risk factors. So we should make sure that we pledge to and the interesting thing is that these risk factors are common across most chronic conditions, right? So be it diabetes, be it hypertension, be it this. So if you do it right, you'll see improvement in all of those aspects. So I think it's important to exercise more, move around more, and as doctor said, don't sit for long hours. Eat right, and sleep well. And I think we can leave. And I think if you see the signs, we will put up a post on the signs of stroke, so the BFAST, so that it's easily available. And if you see the signs, as doctor said, again, take quick action and get to a stroke ready hospital quickly. So thank you once again, Dr. Bhushan, for joining us in our endeavor to spread awareness on stroke and to talk about a topic which is typically hardly talked about, on how it affects how gender affects stroke outcomes.
Thank you for that.